addition to your role as orthopedic surgeon, you're also an active clinical researcher. So have you, seen any data gaps or gaps in equity of opportunity through your research career as well?
Yeah, well, we know that data gaps exist everywhere in the world, and medicine and orthopedics is no exception. And I think the whole idea of data gaps is really, really fascinating. And when you look more closely at it, you can see there's data drives our decisions. And when we don't have data, we make our decisions based on the data we have available. So when you have a big gap in data, it just shows you that our decisions are being made on incomplete information. So we see this in orthopedics for our patients. So we can see it in how we offer patient surgical procedures. There was a bunch of studies that came out about 10 years ago out of University of Toronto that looked at knee arthritis. And one wouldn't think that knee arthritis was necessarily a gender biased condition. You know, you have a worn out sore knee. But James Wright and some of the researchers in Toronto looked at, you know, if you had a woman and a man who both had equal knee arthritis, orthopedic surgeons were much more likely, by 22 times, I believe, more likely to offer a knee replacement to a man versus a woman, even though they had the same x-rays, same complaints, and same levels of pain. And that really shows you that there's some real unconscious bias about how we see patients and how we think patients react to pain and when we offer them a surgical procedure. And we see this again, and it goes further on in our data that we've done at Banff Sport Medicine. When we look at outcomes, one of the things we study a lot is patellar instability. And patellar instability is at least 75% women affected by patellar instability. So, you know, we see that over the years, there's been an under-treatment of patellar instability. Now, is that because it's always happening in women and, you know, doctors haven't addressed that? That's a bit of a leap and can't be proved. But, you know, in these conditions that affect women more than men, are we under-treating them? And then when we look at their data after surgery, are we analyzing that data appropriately? So most trials don't have enough women enrolled in the trials. So many trials contain just men and their outcomes. When they contain women, they may not actually analyze the data as per gender. And sometimes they'll say analyze the data as per gender. For example, our study on MPFL reconstruction, when we looked at outcomes, we looked at men versus women, and oh my goodness, women actually didn't do as well after an MPFL reconstruction as the men. And I'm like, that could easily go out into the world saying, well, maybe we shouldn't do MPFL reconstructions in women, they just don't have as good outcomes as men. But then we looked at pathoanatomy, and women have far more pathoanatomy than men. So women come into this surgery way worse than men from a pathoanatomy point of view. So we actually wouldn't expect them to have such as good outcome measures. So when we took that into account in the data analysis, it was clear that men and women did equally well after MPFL reconstruction. So how we analyze the data, if we include women in the analysis, and then how we look at that is really, really important. With regards to the data gaps for researchers, there is a lot of data on this. And there's a lot of data on the fact that women are less likely to be hired in positions like in the university as research assistants, coordinators, as professors, as leading research than men. Once they get hired, there's lots of data showing they're promoted less than men. There's also information that it is more difficult for women to be published in peer-reviewed journals than men. They receive less grant money than men, and they're on fewer editorial boards of the journals than men. And this has been really recognized again by Dr. Julie Silver, and it's really part of the #NeedHerScience campaign that's going on, looking to improve the number of women in those leadership positions, especially in the journals. And again, if you have women and diverse leadership in the journals, all that will trickle downhill and hopefully fix some of the gender gaps that are lower down.